Hi, I'm Dr. Benjamin Sloop. I'm an interventional pain doctor here at Elite Physical Medicine and I also serve as our medical director. I chose to get into medicine because I am passionate about helping people. I specifically chose pain management because as a young man, I watched my grandmother struggle with a compression fracture in her back. I actually went with her to the doctor's office. She had a procedure called a kyphoplasty done, and she walked out of the office pain-free that same day. Seeing her have pain relief immediately gave me a tremendous amount of satisfaction and a lot of curiosity, and I knew that that's what I wanted to do. I did my medical training at Eastern Virginia Medical School in Norfolk, Virginia. I did my residency training at University of Kentucky in anesthesiology. During my residency training in anesthesiology, I missed having contact and close follow-up with my patients. And I decided that pain management, again, would be a good fit for me because I really like to get to know my patients and have a long-term relationship with them. I also really like to work with my hands, and because of that, pain management was a great fit for me. And I found that I'm able to provide those services now that a doctor provided for my grandmother. I can provide those for my patients now as well. As a physician, I am able to bring more tools to Elite Physical Medicine to help a broader range of patients and to help those patients who may have complex pain to offer these interventional approaches that can help patients stay off of narcotics. These interventional approaches also can help patients participate in the rehabilitation treatments as well. And what this means is we have a better outcome for our patients and we're able to treat more patients and more intensively. Our team here is great because everyone approaches your pain from a different perspective. We have the perspective of a chiropractor. We have the perspective of a nurse practitioner. We have a very rehabilitative type perspective to your pain. The other perspective that we bring that's unique is we're combining this with the interventional pain approach. So we feel like we are treating your pain from all these different angles in order to help you have the best result possible. It's not uncommon that we have someone who comes in and they are in excruciating pain. What we can do is we can get them an injection done quickly and efficiently, and then with the help of that injection helping their pain, they can then participate in a lot of the other more rehabilitative type treatments that can help them get better long term. We treat everyone here at Elite Physical Medicine. We specialize in painful conditions of the spine and nerves. We treat patients with low back pain. We treat patients with sciatica. We treat patients with neuropathy. We treat patients with neck pain. We treat patients who have had back surgeries in the past. We treat patients who have knee pain, shoulder pain, bursitis. We treat this full range of orthopedic, musculoskeletal, and nervous system conditions. You will not find the services offered by Elite Physical Medicine anywhere else in this area. You will not find the combination of chiropractic care, physical medicine, and interventional pain working together as a team to help a patient reach their goals. It doesn't exist. This is the right combination of the right providers in the right sequence to help you have an incredible recovery and to help you have the best outcome possible. One of the conditions that we treat that we feel is the most beneficial and most helpful for patients is a condition called diabetic peripheral neuropathy. It's very common. We have a really unique approach to this, and we use a cutting-edge technology called a spinal cord stimulator. So the typical treatment for neuropathy that most people go through is they'll go to their family doctor, they'll complain about the symptoms. Their family doctor will send them to a neurologist. They might have a nerve test done showing neuropathy, and then they would probably get started on some sort of medication like gabapentin or Lyrica. A lot of people can't tolerate those medications because they have terrible side effects. This spinal cord stimulator system is a novel treatment for diabetic peripheral neuropathy. We've done studies with the spinal cord stimulators, and we know that 85% of patients get at least 50% pain relief. And it's truly life-changing for them. Some of the symptoms of neuropathy include things like burning, numbness, tingling, cold, hot sensations. The spinal cord stimulator can help with a lot of those symptoms and can even help with the numbness we're finding more and more now. This is a very unique treatment. You get to do a trial first. It's all done through a needle, no surgery. We place a small wire next to your spinal cord, and it uses electricity to control the signals that your spine sends that are painful, similar to a way that a pacemaker might work to control an irregular rhythm in someone's heart. So it's unique that you get to keep this and try it for yourself. You'll keep it for a week. You get to see if it helps you. If it helps you, it's a small surgery to implant, and it should work well for you for many years to come. So I want to share with you now a model of the spinal cord stimulator and tell you a little bit more about how this device works. So here you have your spine. You can see these small wires that go just beneath the surface of the bone here, next to the spinal cord. You see this small battery. During the trial, this battery is external. With the permanent implant, the battery and all of this is buried underneath the skin. You can see how small this device is. I like to tell people that it's about the size of an Oreo cookie. The device comes with a remote control. This control you can use to turn the device up, down, off, on. The possibilities with this truly are endless. It's a great therapy. It helps people tremendously with their nerve pain, and it's covered by all major insurances, including Medicare. The trial is the key to this entire process. The trial is your opportunity to see if this device and this technology is right for you personally. The commitment is about a week of your time, and this week and this commitment can change your life. This could be one of the most important decisions that you ever make regarding your pain treatment. I've had many patients who were scared or concerned about having a stimulator trial. They'd heard stories of a friend or stories of a family member who tried it and didn't help them. I tell the patient that I can't vouch for someone else's experience, but I feel strongly that this can help you. And I'm happy to help you get the trial done to see if this helps you. And that is the key to knowing if this is the right treatment for you, to come in, to see us, to do the trial. If the trial helps you, the rest is easy. But we need to do the trial first. That is what convinces you, that is what convinces us that this is the right thing to do for you and the best thing to treat your painful neuropathy. So here's what you would expect if you came into the office for a consultation with diabetic peripheral neuropathy. You would visit with one of our providers. You would have a history and physical exam, and we would introduce this technology for you if we thought that you would be a good candidate for it. The procedure does require some workup before that we can actually do the stimulator, so don't expect to have the stimulator done that day. The preoperative workup consists of 6 months of failed conservative treatments. If you haven't done the conservative treatments yet, don't worry, we'll help you out with that. It's just important that you come in and see us. We can take care of that portion. We'll order x-rays of your back. We would order an MRI if we were concerned about anything additionally there. And we would send you to see a psychologist. That's an insurance requirement. And we also will consult with your other doctors, your primary care doctor if you have one, a cardiologist if you have one, any other specialist that we think would be necessary to obtain any additional information before we decided that this was the right treatment for you and that your other medical conditions are well controlled in a manner that it's safe to proceed with the stimulator trial. If you're on blood thinner medicines or have had stents in your heart or a heart attack in your past, we might talk with your cardiologist and make sure that your heart was healthy enough to come off some of those medications in order to have the procedure done. Once we get it approved, we call you to put you on our surgery schedule, and the procedure itself takes about 30 minutes or so. You will be seen in the surgery center before your procedure. We'll discuss the procedure, we'll discuss how it's to be done, we'll discuss any restrictions, we'll place an IV, and we'll give you a little bit of sedating medicine. During the procedure, you're laying flat on your belly. We clean your back off with a cold cleaning soap, and we place a drape over you, covering you from head to toe. We then use the x-ray camera to use a small needle to access your epidural space, similar to when pregnant women have an epidural injection. We then place the little wire through that needle into your spinal space. Typically, that's not a very painful or uncomfortable sensation for most people. Once the needle is in the right place and the wire is in, we take out the needle, leaving the wire in place. We plug it into the small battery device here that we've shown before, and then we tape all of this down on your back. You'll then leave the surgery center, you'll go home, and you'll keep this device for about a week. During that time, there are a couple of restrictions. We don't want you getting the device wet, so no taking a bath. We also would prefer if you didn't get too sweaty. That can obviously cause some issues. But other than that, there aren't a whole lot of restrictions during the trial. This is your opportunity to see if this device helps you. You'll come back to the office in about a week. We'll take the wires out in the office. And honestly, when we take the bandages off, almost all the time the wires come out with that. It's not a painful experience at all. And we'll discuss the trial. We'll discuss how has the last 7 days been for you. Have you had pain relief? Have you had improvement in your function? Have you been in a better mood? Has your family noticed that you're doing more? In some instances, people will tell us they've taken less pain medications, and that's always a good indication as well. And if this helps you at the time of your follow-up visit where we take the wires out, we would recommend going ahead and scheduling the permanent implant. We can talk about the permanent implant a little bit as well. It's a very similar procedure, except you'll have full anesthesia. You'll be asleep during the implant. Of course, during the trial, everything's externalized, so we make 2 small incisions to anchor the wires beneath the surface of your skin and also place the battery beneath the skin. It's a very small procedure. It usually takes about an hour to put everything in permanently for you. Recovery from this procedure is not very complicated. Most patients recover almost fully within 2 weeks or so. There are some restrictions because we don't want the little wires to move before you've completely healed. Really, for 2 weeks, we have you not doing a whole lot, and that's just to let those superficial scars heal completely. Then we do about another 6 weeks of restrictions. We don't want you doing lifting, bending, twisting, reaching over your head, or straining of any magnitude. We may have you wear an abdominal binder as well. That's a device that almost looks like a back brace. It's not a big deal. It's not anything that's uncomfortable or bothersome, but what that does is it helps the healing process. After those 8 weeks of recovery time, we typically lift restrictions and you can go back to your normal way of living. I personally have had tremendous success doing the stimulators. I've seen people's lives change from this. It is not uncommon with a spinal cord stimulator that I have a patient telling me they're getting 80 to 90% pain relief from the trial. I have people who couldn't walk around the block and now they're walking a quarter to half a mile. They're actually exercising. I have patients who even tell me that they're getting feeling back in their feet. So it truly has been a very, very, very remarkable advancement in medicine to help patients who really don't have a whole lot of other options, and especially for patients that don't want to take a medicine or can't tolerate a medicine that has bad side effects. My practice is primarily centered around the interventional pain techniques. I've done several hundred of these within the last 6 years, and I've seen these phenomenal results repeated time and time again.
Hi, I'm Lindsay Schulte. I'm a sales representative here in the Cincinnati market for Nevro HFX therapy. Nevro is the newest spinal cord stimulation technology on the market. Spinal cord stimulation's been out for 30 plus years, but we're unique in this space in the fact that we've been awarded by the FDA as a superior product. Why? Because we have the patent on our frequency. So traditionally, in the past 30 years, spinal cord stimulation has run in between 2 and 1200 hertz. We have the patent to run 10,000. We run 10 times the amount of frequency than anyone else on the market and have been able to achieve superior reliefs for patients suffering with back and leg pain, and our newest, most exciting indication, painful diabetic neuropathy. How we were awarded this indication by the FDA was a submittal of 24-month data with over 200 patients studied. In this study, we found that 85% were responders. 73% of these patients gained pain relief. And then out of that, 62% of patients had neurological symptom restoration, meaning the numbness, the tingling, the burning, the hot, the cold feet were reduced by over half, which is just a game changer for this patient population that's been suffering and has really minimal options out there. We take a lot of pride in, we really are a partner with the practices. So we work hand in hand with Elite as well as Dr. Sloop. We're part of your journey. You'll meet us at your consultation. We are there at the trial. We talk to you every day during the trial. We report results back to Dr. Sloop and Elite. And it's the best part of our job because we're able to have a front seat view of how well you're doing in your life. And we're measuring not only, your function, but how's your sleep, and, can you feel your feet now? Are you able to reduce your medications? So really we have a great spot in the process. And then thereafter, we're part of your journey moving forward. We're at your implant, we're at your post-op appointment. So we do become part of your care plan. We're looking forward to meeting you and helping you achieve those results that you're looking for. Myself and my team here is to assist you through the whole process.